Welcome to Adapting Class. Thank you for deciding to watch this video. You'll never regret for sticking around. It's content mastering of NCLEX. Listen to the way I'm going to approach it. Good luck in your exams, and let's go. It will be very quick, high yield fact, and content mastering. Number one, as usual, you got to be sharp. And when you're sharp, there's no prioritization question you will mix it. What does that mean to be sharp? The B, you're talking about breathing problem. E, electrolyte, shock sepsis. H, okay, hypothermia, hypoglycemia. Airway, and R, lethargy, which is neurological problem, and pain, okay? The pain is pain that you're going to lose your life in your eyes and your limb. Therefore, that is the key aspect of prioritization. You can have whatever content you have to do or strategy for prioritization. But this is the way I approach it. Expected finding, or you're going to be sharp. And what do we have? The client presents to the emergency department at the same time, 4 of them. Which client should be seen first? Straightforward, I'll just give you the key content and then we answer it, right? Which of it? A client with the backing cough presumed to be what? Croup. A client with fluid-filled rash presumed to be varicella. A client, what? After exposure to a friend with tuberculosis 24 hours ago. A client with presumed infected VRE of the leg. Who should be seen first? What do you need to do? Divide the case or the question into 2. If you have backing cough, what do I expect? You have croup. If you have fluid-filled rash, what do I expect? You have varicella. If you are exposed to your friend who has tuberculosis 24 hours ago, you need the test. If you have infected VRE, you need to be isolated. But if you have 1 second, who are you going to give it to? Somebody with an expected finding from having a backing cough. There's no problem about whether it's having an issue. All they told you, backing cough. Cough is not enough. But if you have varicella, you have airborne. You're going to expose everybody. Everybody is going to get sick. If your friend get exposed to tuberculosis, all they're going to do is PPD. We don't know that whether the patient has infection already. And if you have VRE, you got to be in contact precaution. Which of these is troublesome? Varicella, because of the airway. Adapting class way, test taking strategy based on 1 second and what you need to do for this patient. Number 2, and let's provide care for several clients. The same concept, very quick, like I told you, same concept. Which client situation need immediate intervention? Left pneumonectomy, who is on the left side? Right pneumonectomy on the right side. Left thoracentesis on the left side, and right thoracentesis on the left side. What is the concept? We are going to master the concept for this. Pneumonectomy, you're always going to be on the affected side. That means I remove your lung. Thoracentesis, you should not lay on the affected side so that that portion of the lung can develop. Therefore, if I remove the left side of your lung, it's okay to lay on the affected side. If I remove the right side of your lung, it's okay to lay on the right side, affected side. If I puncture the left side of your chest, thoracentesis, you remove some fluid, you should not be laying on that side because that side is injured. If I puncture the right side, you should be laying on the left side. So which client situation need immediate intervention? Number 3, test taking strategy, care concept that you need to know. Number 3, a nurse is aware of all clients at change of shift, which intervention should be implemented first. Implementation of intervention. Therefore, what you need to do, divide it. Find what is the problem and what they need to do for them. You have what? Albuterol for a client who has asthma. But what is the problem? He's 99% sad. He's not in distress. Do you want to worry about him just because he has asthma? You want to pick it? No, don't pick it. It's a trap, and you're going to get it wrong. Urethral catheter, right? He has what? Urine retention. Fine, we're going to relieve the retention. Dicyclomine is an anticholinergic. If you have crampy abdominal pain, it's going to take care of it for IBS, right? Chlordiazepam, alcohol withdrawal. Be sharp, not expected. And if you have 1 second, who do you want to give it to? This guy is in alcohol withdrawal. He's going to go into DT. When you go into DT, he has airway issue. It's a priority for you. Discomfort, I'll give it to you. Pain is not going to kill you from this. Urinary retention, I'll put the following. Asthma, your SAT is 99. I'm not worried about your net. I'm worried about somebody who's going to go into DT. Number 4 is your right answer. And this is aware of all client at change of shift. Which client should be seen first? Same strategy. Don't let them fool you. Don't let them take this point from you. Just stay your ground and go with the concept and see if it's expected or not expected. Myasthenia gravis, what did he have? Severe leg weakness. What is the priority for myasthenia gravis? Airway, slurred speech, dysarthria. Do you see that there? Ignore it. Client with Bell palsy, what do I expect? He's going to drill because that side is not working on the affected side. Did I say he's having airway? Just because I put drill in there, you're going to pick it? Ignore it. A client with left cast, he has total paresthesia. Paresthesia is the early signs of compartment syndrome. Do you want to ignore this? No, you got to pick it. 2-hour laparotomy, he has pain, 8 out of 10 abdominal pain when coughing. Well, I make incision in your abdomen. If you cough, it's going to hurt. Unexpected finding, just because the pain is 8 out of 10, I never say he has peritonitis, right? There's no guarding, there's no rebound, nothing like that. Therefore, right answer, number 3. Number 5, a nurse is assessing a client with what? Interception. Which of the following the nurse should expect? Content, content, content. All you need to do, go for the buzzword. Interception. What do you know? The bowel is telescoping on itself. So what are you going to expect? Carrot jelly stool, interception, but they don't have olive-shaped mass. So this is wrong. Sausage mass is good, but they don't have projectile vomiting. Therefore, this is wrong. Dehydration and scaffold abdomen. This is what? Pyloric stenosis. Most people test taking strategy, since you have eliminated 1, 2, 3, you got to pick 4. But this is the key. Most people with interception, they will be crying unconsolably. They'll bring their knee into the chest so that they can open the rectoperitoneum, the backside, to relieve the pain. So number 4 is your boy. Number 6, and this is aware of 4 client at change of shift. The nurse should first follow up with the client who has what? So who need your attention? 1 second. The blood glucose of 62 and heart rate of 66. He's doing great. If he has hypoglycemia, it's going to be tachycardia. Don't pick it. A respiratory of 22 and tachycardia. His respiratory rate is going up, he has tachycardia. This is okay. It's not that bad. You have abdominal pain, 7 out of 10, but what do you have? Guarding. This is the peritonitis. You have colostomy 6 hours ago, and it's red, unexpected finding. Number 3 is your answer choice. You have to be sharp. And this is aware of 4 clients. Which client intervention the nurse should question? Client with what? That means you see if the problem is not consistent with the treatment. Always divided. When they say question it, divided. IBS, right? What do? You give them anticholinergic, dicyclomine, you're good. Depression, what do you need? You need the SSRI, you're good. Anorexia, you don't eating, and I give you bupropion, you're not going to eat anymore. You're going to have bad problem. Therefore, this one is, I have to worry. Tourette syndrome, these people, they have tics. The tics are due to excessive dopamine level. And so they start moving too much. Find something that blocks dopamine. Phenazine, antipsychotic, first generation, are your friend for treatment of Tourette syndrome. And therefore, this is good. If you don't know that, that is the content. Therefore, right answer, number 3. We got a question there. And next assessment of a 48-hour-old newborn shows failure to pass meconium, constipation, abdominal distension, and poor feeding. Which additional finding is consistent with this condition? I want to test your knowledge about case study. Short one, but yes, it's loaded. 48 hours, he has not passed meconium, one buzzword. Constipation, one second buzzword. Abdominal distension, buzzword. And poor feeding. Look at it. If you have not passed meconium, stool stay here, your belly is going to get bigger, right? Distension, it gets bigger, you develop constipation. And if the stool is not coming out, it has to come out from your mouth. So you are poor feeding. What condition does that? Abdominal wall defect? No, that's gastroschisis or emphalocele. No. Blood tank mucous membrane, mucoid stool. This is intussusception. This does not look like that. Failure of the internal sphincter to relax. Yes, the internal sphincter cannot relax because of a ganglionic cell, leading to Hirschsprung disease. This is classic Hirschsprung. Imperforated anus, no, they have anus, but this is not a condition. Therefore, number 3 is Hirschsprung disease, and so that's your right answer. Once again, pause the video, answer the question, and see how I'm going to approach it. Number 9. The nurse provide care for a 4-day-old newborn client diagnosed with what? Hirschsprung. The client now has fever, foul, and explosive diarrhea, abdominal pain. Remember, they cannot pass stool. This is the content for 48 hours. It's been 44 days. They have not passed anything. The belly is going to get distended. All the stool that is sitting there will cause infection. And when it causes infection, they have explosive diarrhea, abdominal pain, and fever. What they're going to have is the colon. So enterocolitis. So it's both the colon and the small bowel. That's what you call enterocolitis, not just colitis. It's enterocolitis. So number 3 is a condition that this patient with Hirschsprung is feeling. Number 10. And then it's reviewed the medication and indication pairing below, which pairing is accurate. Find it and see which one is accurate. I said losing mucus. I give you physophenidine. What does it do? Ask yourself, what is that pharmacology? If you need help, check adaptant class or come to our crash course. We have a crash course coming in 1st of June. You can email me or check my YouTube, and you'll find it, right? What is this, right? This is a medication. It's an antihistamine. Most antihistamine does not losing mucus. Therefore, this is wrong. Antihistamine, Sudafed. This is not, Sudafed is not antihistamine. It's a decongestant. It breaks down the mucus, it makes less so that you don't, it causes basically vasoconstriction so that you don't have to make it. Cough suppressant, dextromethorphan. This is correct. It suppresses your body from making cough. And so that's what we use in cough mixtures. Antiemetic, this is not antiemetic. Hydroxyzine, this is H2 blocker. Therefore, number 3 is the right answer. This is a hard one. It's a pharmacology, just for your bonus to know the function and the names of these medications. Number 11. The LPN provide care for a client with what? Addison disease. That's the buzzword. Look at the way I'm answering question. I go for the buzzword, I circle it, and I bring my content, and I use it to answer the question. Addison disease ready to be discharged home. Which prescription the nurse should anticipate? What is Addison disease? It's an adrenal problem where adrenal function is affected. Therefore, you cannot make ADO and steroid, corticosteroid. Therefore, they need corticosteroid and they need ADO. Well, there's corticosteroid here, but salt substitute. Salt substitute means you're having potassium. Addison people, their potassium is too high. You can't do that. Protocortisone, this is what will give you aldosterone, right? And then if you give them spironolactone is going to block aldosterone, negative. You give them hydrocortisone, they're happy. But you give them trimethoprim, it's also like a spironolactone. It's potassium sparing. It's a problem. Therefore, hydrocortisone and procortisone is what you need. 2 medications for that. This is the pharmacology. 12. And this is providing teaching to a parent of a child with enterobiasis infection. This is pinworm infection. This is, I call it itchy bat, right? Your bat itches and they lay eggs around the anal opening and you scratch it and you put it in your mouth and you keep on getting the reinfection. Because of that, this is a good test question they may ask you. Okay, very, very good. Because of the reinfection, you wash your linen in warm water. There is reinfection all the time. So you got to be treated more than once. Child should stay home until treatment is over. No, you don't need to do that until you started antibiotic. You should be fine. Child should bath twice a day. Bathing, when you stay bath, the water that you come out of your body, you are laying on it, so it get recycled. No bathing. You should take shower. You need to cut your nail flat so that when you scratch, there's no eggs in your fingernails and you don't put it in your mouth. One therapy is oral therapy is 1 time. No, you need it 2 times. So the only answer is 5. In all these questions you'll be doing, know that when it says select or apply, you don't have to pick everything. Pick those you're confident. If you want, you're confident on that, pick it. If 2, pick it. You pick what you can buy it. Okay, you can pick multiple things, you can buy them. So just make sure whatever you selecting, you can chew it and swallow it. So take care of yourself on that. That is select or apply. Just pick those you're confident. Number 13. The nurse has attended the staff education program on antipsychotic. Which medication the nurse should classify as atypical, right? There's a typical antipsychotic and atypical. Atypical is 1st generation. Atypical is 2nd generation or 3rd generation. How do you recognize typical one? They have weird name like Dazines, Fluphenazine, Allopuridol, Antioxidant. Aripiprazole is a 3rd generation, 2nd generation like. Therefore, it's atypical antipsychotic. 14. RN assign tags to the LPN, which tags the LPN VPN knows is safe for delegation by the RN. That means what can they do? All I say is delegation, monitor MMR most. That means monitor RN, give most medication, reinforce, do some stomach care, tube feed, and special tests. You see the word reinforce, I know is the right answer. Reinforce teaching is good. Monitor, I see monitor here, you see it's here, right? You're monitoring RN finding, right? Administer the prescribed medication. They can do most medication. So this is also good. Assesses is done by the RN. And when do you assess client who is being admitted? That means he's still being admitted. He has not finished. They need extra workup. So this is initial man assessment. The nurse can have to do it. Administer tube feed to a client. They do what? Tube feeds. Therefore, they can do gastrectomy. So 1, 2, 3, and 5 are your right answer. 1, 2, 3, and 5. 4 is wrong. That is how you do delegation. The LPN VPN review the assigned tasks. Which tasks will be appropriate for the LPN VPN to complete? That means which one LPN can do that. I already told you the technique to do that. The technique to do this, I've already given it to you. So therefore, what do you need? Assist the client in ablation. They can work. They can monitor blood glucose. They can obtain vital sign if they work with the RN, right? Obtain vital sign the first 5 minutes of blood transfusion. RN has to do it. They can reinforce teaching. So 1, 2, 3, and 5 are your right answer again. LPN is teaching a UAP about log rolling a client, which condition the technique is most often used. The LPN will discuss in the teaching. I intentionally said this long. Or I'm asking you the buzzword, go for it. Log rolling. How do you log rolling and which condition it can be used? Your leg, you can log roll somebody when their leg is injured, unless even their hip is injured, you don't do that. Neck here is for spine problem. You want to keep them straight to prevent spine fracture. Abdomen is not included. I see spine here, and your chest is not included. So 2 and 4 is a better answer choices. The LPN RN is teaching a group of UAP about log rolling a client. Which action the LPN should include or not include in the treatment or in the teaching? So how do you do that? You need at least 2 people to help you, so include. The client need to cross their arm across the chest so that they don't get injured. Okay, they have to be rolled onto one side as a unit, right? Small pillow should be placed on the leg, right? And then 2 nurses on the side where the patient will be rolled so that they can cut them. You apply blanket under them and use it as a draw sheet to take it. And the nurse grab up in the lower portion as a unit and they roll the patient. This question is designed for content for you. So if you don't know how to log roll somebody, this is what is done and this is what the purpose of it. LPN as reinforced teaching to a client on a proper use of scopolamine patch. Which statement made by the client indicate ineffective teaching? Select or apply. I use the word LPN, RN. It doesn't matter. Whatever test you're taking, I just wanted to emphasize something to you. The content is still the same. Therefore, which statement made by the client make this is ineffective? Why? Proper use of scopolamine. Don't worry about the scopolamine, worry about the patch. Therefore, I will keep one patch at a time. Always keep a patch one at a time. So this is not ineffective, it's effective. The patch will need to be changed 72 hours. It's good. So this is good. I will clip off any air at the application site. Watch for this trap. The buzzword is clip. Shaving is wrong, but you can clip with the clipper. It does not cut you. So this is not bad. So this is good. I will reinforce the patch with tape if they're coming out. Yeah, there's nothing wrong with it. I will not shower while the patch is on. No, you can shower. It's waterproof. So 5 is the only answer that I need. Is it indicate ineffective teaching. So number 5 is ineffective teaching. Number 20, a nurse has attended staff education program on preterm labor. Which prescription the nurse should expect when caring for a client in preterm labor? What do you need to do? Test taking strategy, buzzwords, preterm labor. That's all. Which of this, and then you break it down. What is preterm labor? You're contracting more than you're supposed to do because you're not due, and then you get into trouble. Therefore, what do we need to do? Priority is to slow you down. Am I going to slow you down? I give you medication. Terbutaline, slow you down. Magnesium, slow you down. Pitocin, no, it does not slow you down. Methagonovine, no, it does not. They are used to ripe the years. Endomethacin, slow you down. Nifedipine, slow you down. So which one I use? 1, 2, 5, 6. I would use in preterm labor. These are medications you have to know. LPN has reinforced teaching to a client with diverticulosis on proper client choices, which client choice by the client, which diet choice by the client indicate teaching is what? Ineffective. That means ineffective. So go for the buzzword. Select or apply. Read it from the back. It say ineffective. Then I said diverticulosis. So I got to teach you about what? Diet. What is the problem? Diverticulosis is lack of fiber. Therefore, what is my teaching? Give you more fiber. Green vegetables is fiber. Whole grain is fiber. White rice is not fiber. Need teaching. White rice and lean meat need teaching, right? Refined white bread is not good. So we want to give you what? Something that is stronger and has fiber in it. Therefore, which one do you want to go with? I don't like you refined. Egg and cheese is not. So 3, 4, 5 need indicate ineffective teaching because they don't have fiber in it. Number 21. The LPN has attended staff education program with cystic fibrosis. Which complication the nurse should recognize to be associated with cystic fibrosis? What is the major problem in cystic fibrosis? Lack of mucus secretion or clearing of the mucus in the organs, right? In the lung and the pancreas. So answer choice would be related to lung and pancreas. Infertility because you can't get rid of the semen. So this is good. Pancreatitis, yes, because you can't get rid of the pancreatic juice. Failure to thrive, you cannot grow. This is a trap. Apple diabetes insipidus, they have nothing to do with water problem or ADH. What they will develop is diabetes mellitus, not insipidus, and they can have recurrent pneumonia. So 1, 2, 3, and 5 are your right answer. RN or LPN provide care at a clinic for a client with what? Recurrent lung infection. Look at it, pay attention, buzzword. And it takes what? Pancrealipase with meal. I've given you the clue. These are the buzzwords. You have recurrent lung infection, you take pancrealipase. What order do the nurse expect? Break the question down, put it together, relax. Lung infection and you take pancrealipase, this is cystic fibrosis. Therefore, what lab work do you expect? What do they lack? A, D, E, K. They don't like vitamin C. They don't have any potassium problem. They can develop diabetes. I'm going to get hemoglobin A1C, and I don't worry about blood culture. The LPN review the RN notes. Elderly, okay, older patient, his face is maxed. He has slow, what? Movement, and he has shuffling gait. Can you make a diagnosis? Older patient, he has maxed face, he has slow movement and shuffling gait. This is what? Parkinson. Which prescription the LPN should expect then? If you have Parkinson, what do I expect? Two key things. We should have anticholinergic, okay, anticholinergic and dopamine agonist. So do you see dopamine agonist? Yeah, this is dopamine agonist. You see anticholinergic? This is anticholinergic. Test taking strategy. Pick this. This is first generation antipsychotic. They block dopamine and they worsen Parkinson's disease. This is my favorite question. Make you think. Next, provide care for a client with hypertension and PTSD related nightmare. Which prescription the nurse should expect? This is content. If you know it, you know it. If you know, the keyword is PTSD related nightmares and hypertension. Which of these medication can be used for hypertension? All of them. And then you say, which one is PTSD related? Worry about neurological problem. And therefore, alpha blockers affect your neural status. That's why you got to pick this processing. The nurse is ready to perform gastrointestinal assessment on the client. Which action the nurse should take first? You're about to do abdominal exams. Do you position the client supine? Did you inspect the abdomen? Did you place a pillow under their knees, or ask the client to void? Voiding, provide some comfort, and they can lay down and help with the assessment without any problem. So number 4 is right answer. This is just a concept question. If you know it, you don't. LPN has attained the staff education program on restraint, which restraint the LPN should anticipate will be ordered to prevent the client's ability to rise or stand from a seated position. English questions give you a clue. They have to have the badge resonate. Otherwise, it's not a good question. What did I say? Ability to rise and stand from a seated position. Mitten doesn't do that. It's on your hand. Self-restraint is on your wrist. Waist is the waist that will prevent you from getting up. And ankle is your leg. Therefore, number 3 is your right answer. The RN provide care for a client with new diagnosis of what? Congestive heart failure. Which prescription the nurse should clarify? You have CHF. What is the problem? Too much water. I shouldn't give you any more water. Isosorbide is going to decrease the water going to your heart, right? It causes venodilation. And Neuropil help with the remodeling of your heart. Hydrocortisone get rid of the water. And the medicine make you retain water. Acetaminophen doesn't do anything. And steroid make you retain water. Therefore, 4 and 5 are water retainers. You should stay away from it when you have CHF. And said it's bad for CHF patient. Number 28, LPN has attended staff education program on cardiopulmonary resuscitation. Which action the LPN should perform first when the client is found down? You find a client, lay down like that. What do you want to do? It's not ABC. It's RABC. Check for responsiveness. Then you can do your airway breathing circulation. This is key. Okay, so number 1 is your right answer. Number 29. A nurse is assessing a client in the emergency department with muscle cramps and dark tea-colored urine after a marathon run in a hot day. Test taking strategy, buzzword, go for it. Always never forget. You have muscle cramp and the urine is dark after you run for a long time. You've been running on your muscle all time. And then every time you see dark tea-colored urine after you take and the muscle cramp, worry about rhabdomyolysis. This muscle is being broken down. If you have worry about rhabdomyolysis, this cell, when it breaks, the phosphorus inside the cell comes out. So your phosphorus goes up. The potassium, okay, inside the cell goes up. The creatinine kinase, which is the breakdown of the muscle, also goes up. And the BMP, rather, because it's been running for a long time, is dehydrated. So BMP should go down. Right answer is number 3. The outgoing nurse statement to the ongoing nurse. Client was admitted 24 hours ago for unstable angina. Is now post-coronary angiography. Which statement represent which? The client statement represent which component of ISBAR? This is straightforward. So I'll make a video for this about that, but this is straightforward, right? It's just telling you what the patient had, what is done. It's not a situation. It's not worry about it. It has not make any assessment. It's just telling you what's admitted 24 hours ago, and it's now, this is what has been done. The background of the patient is being instituted. And then provide care for a client with new diagnosis of bipolar. Which prescription the nurse should expect in the plan of care? What is bipolar? Bipolar, they have depressive and then a mood is a mood disorder with a two situation where they find themselves either depressed or hyper, right? So the problem is you want to cool them down. With prescription, there's some prescription you should avoid in them. Bupropion, it increases your threshold, and then it makes them more hyper. They're already hyper. You want to give them bupropion, negative. Lisinopril, it will going to decrease their sodium and make bipolar patient who probably will be taking lithium really sick, right? Fluphenazine, why do you need that? Why do you need first generation antipsychotic for them? It's not good. The best medication you give them is a mood stabilizer. This is what is going to stabilize them. So valproic acid is the right answer for patient with the bipolar. And let's provide care for a client with what? Bipolar disorder, who present to the emergency department with what? Tender, blistering, upper extremity rash in the eyes, in the lips, and the mouth. That means they're taking some medication and now they have rash. Most medications for bipolar are what? They are anti-epileptic and they all have sulfur drug. And if they have sulfur drug, they cause rash, which may be early signs of Stevens-Johnson syndrome. Therefore, which of those is anti-epileptic? This guy is a second generation antipsychotic. You can give it to bipolar patient, but he has no sulfur effect. Lamotrigine, yes. Quetiapine is a second generation antipsychotic also. Buspirone will make them not too what? Buspirone is a anxiolytic, right? It's a busper. You don't need it in this situation. So the right answer is lamotrigine. That is an anti-epileptic. The LPN provide care for a client with what? Post-appendectomy, who is ready to be discharged to advance to full liquid. Which diet choice the LPN knows are full liquid? All this is asking you is which one is full liquid. If there's nothing there, you just eliminate it. So you pick an answer that shows a full liquid. If not, you're not going to get the right answer right. So which one is a full liquid and which one is not a full liquid? That's all. So which one you think is a full liquid? Which one is a full liquid? Now, let me show you the strategy to answer this question, right? Milkshake, find something that is wrong. Apple juice is clear, and peanut is a regular one. Custard ginger ale. Ginger ale is clear. It's not a full liquid. Canned food is a soft food. So it's not. Therefore, you're left with yogurt, ice cream, and custard, which are all full liquid. Number 4 is your right answer. 34. The nurse. The visiting nurse assesses an elderly client who is legally blind. And they assess their home, right? Which finding is concerning? Select or apply. You're visiting somebody's home. Which one you should be worried about? Electric shaver in the bathroom. Yeah. Using electric shaver is blind. He can see. If you use the razor, it will cut his face. So if you use electric shaver, it does not have to say this is not concerning. He has grab bar mounted on the airway. Excellent boy. He has electric wire running under the rack. This is bad. He has organizers with different shapes so he can close his eye and touch them and know where they are in the kitchen. He has specialized design pill bottles in the medication cabinet. All of them are good. There's only one answer there. If you pick more than one, you get wrong. Pick those you can pick. You can buy it and then select them. If you feel like you're not confident about it, there's no guessing. If you're guessing, you go take your test and you're guessing, you're digging yourself in a hole. Never guess. If you don't sure, especially for select or apply, hey, by standalone, if it's not select or apply, yeah, you can guess. But this one, you can't guess. And then provide care for a client with autism, which intervention the nurse should include in the plan of care. The key fact is these people don't look at them in the eye, try to ensure consistency, low stimulation as much as possible. Sameness, okay? Make sure they go in retune. Don't punish them. They're going to have impulsivity. Don't punish them and let their parents bring something they favor. Is their favorite so that they know that they are in the same environment as if they are in their house. 36. Nursing team, RN, LPN, UAP provide care for a client. Which task can be safely delegated to UAP? Which one UAP can do? Assist client with walking? Excellent. Replaces the SCD after the patient walk? Okay. You can check the individual blood pressure and blood glucose, but you cannot monitor it. You just check it and give it to the nurse. But monitoring? No. Assist client with mail? Yeah. And monitor client during output. You cannot monitor. So A, 1, 2, and 4 are your right answer. Number 37, and then it says attended staff education program on cystic fibrosis. Which vitamin deficiency the nurse should expect when caring for a client with cystic fibrosis? You can see this is the way they said the NCLEX question. It's just content. They give you some stuff, the first one, but the main beat of the question, the meat of the question is in the second portion of the step. All I'm saying is, what kind of vitamin deficiency do you see in cystic fibrosis? It's just a concept. You don't have to memorize. ADEK. What do I see? A. I don't do this. I don't do this. K and E. That's all. 3 more questions. And as I attend the staff education program on alcohol dependence. Which of the following questions the nurse should recognize is part of the CAGE questionnaire? So if you depend on alcohol, we use CAGE to screen you. Have you felt the need to cut? C. Down your drinking. Are you annoyed by your drinking habit? Have you felt guilty about your drinking? Do you have an eye opener in the morning? That means something you got to take it before you can function. Do you have any psychotic disorder? Most people who have depression, the alcohol dependence may have psychotic issue, but that is not part of the CAGE. So 1, 2, 3, 4 are your right answers. 2 more. And as I provided diet instruction to a client with new diagnosis of what? Celiac disease. Celiac. Which diet choice by the client indicates effective teaching? So celiac, stay away from broth and do the CPR. What is the C? Corn, potato, rice. Look at it. Potato, rice. I see rice is good, but I don't see rye bread. I see corn is good. I don't see an oatmeal cookie. I don't have any of them to do with this thing. Number 4 is my board. And the last question. Thank you for sticking around. Thank you for listening. And let's provide care for a client with HIV. Which infection below is an opportunistic infection in this client? That means infection that only HIV patient or immunocompromised patient can get. That's all. So which of these things you think is it can be found in immunocompromised patient? We all have mycoplasma pneumonia. We all have infectious mononucleosis. We all have haemophilus. But this histoplasmosis pneumonia is bad. Okay, they have spores. You take in, you breathe in. It's because it's pneumonia in immunocompromised patient. Therefore, what are we going to do? That's our right answer. Thank you for sticking around. I hope you gained something. If you need more content, you can join our membership on YouTube or the Adapt NCLEX Clash course that is coming on in July.